Hi, everyone. Welcome back to Becoming Gwendie. I'm Gwendie Bell Moon, author, storyteller, celestial traveler. We are here today to continue the Metamorphosis, and that is a journey of my weight loss and my beginnings into a healthier lifestyle. So, today I wanted to talk about how I prepped for surgery and what the surgery day and early post op reality was like. By the time I reached surgery, I had already completed really a significant amount of preparatory work with my functional medicine specialist that I talked about last week. And because of that, I wasn't really required to undergo the extensive nutritional evaluations that a lot of people do in their programs. A lot of bariatric patients are asked to complete some, jumping through rings of fire with their nutrition. And some are even asked to go on like a 2 week completely clear liquid diet to shrink their liver prior to surgery. But I didn't have any of that I required from my surgeon. Actually, my surgeon reviewed my history and my labs and my overall metabolic picture and felt confident that the foundation was already there. And so I got to bypass a lot of that from the nutritional aspect. One thing that really surprised a lot of people and honestly surprised me at first was that this surgeon did not require a preoperative liquid diet to shrink my liver. He actually reasoned that, his rationale was pretty straightforward. He explained that if you have, a 600-pound patient who loses 40 pounds before surgery, they're still going to have a very enlarged liver. And so from his perspective, rapid weight loss before surgery didn't meaningfully improve outcomes for most patients. And in some cases, added unnecessary stress on the body prior to surgery. And in some situations, even managed to get somebody pushed back from surgery because maybe they couldn't stick with the 2 week liquid diet and they end up, gaining a couple of pounds prior to surgery. And that's no good for anybody, and they'll cancel your surgery for that. So, what I gathered from that conversation with my surgeon was that he prioritized long-term physiology and safety over short-term optics or, ritualized requirements. Some of these doctors require the liver shrinking 2 week diet on clear liquids just because that's how things have always been done. But you'll find a lot of that in medicine. And so, I have thoughts about my bariatric surgeon. They're not all positive, but I do think he was on to something there. That was a good decision for me anyway. And, that said, approval for surgery wasn't casual and it wasn't rushed. There were a lot of medical and psychological hoops I still had to jump through before receiving clearance. I had to complete an EKG to evaluate heart rhythm and cardiovascular readiness for going under anesthesia. And, back then everything was fine. Now I have some heart wall motion issues that I found out after this last cyclic vomiting episode. And but prior to my gastric sleeve, my EKG said that I had a good heart rhythm and that my system was ready to go for surgery. And I had full lab workup done, and it assessed things like liver enzymes and electrolytes and blood counts and metabolic markers. And I also completed an EGD, that's an upper endoscopy, where they consciously sedate you and they go in through the esophagus to look at the esophagus up and down and the mucosa in there, and to check out the stomach and the sphincters, and they're looking for ulcerations, inflammation, or some kind of structural issues that might cause complications during surgery. And then there's, the psychological aspect. And having been a nurse who actually did medical necessity evaluations for several insurance companies over the years, this is the part that tends to scare people, and they feel like, am I going to say the wrong thing? Am I going to get my surgery denied because maybe the psychologist thinks that I'm depressed or something? And I'll tell you, I've evaluated those surgery situations many times for many, many, many different patients. And I can only recall over the years of knowing of one person who ever was denied a bariatric surgery based on their psychological evaluation. And that particular person had just lost their mother, and their mother had passed due to some complications that were exacerbated by being overweight. And immediately, as soon as this woman's mother passed, again, complications being due to being excessively morbidly overweight, this woman said, aha, I have got to have this bariatric surgery immediately. To which all doctors are going to say, whoa, you're making this decision with high emotions, and you need to bring yourself back down to a calm state before you make this decision. And after something as significant as losing a parent happens, you're not in the right frame of mind to make decisions on life-altering surgeries. And so that was the only situation that I ever saw someone get denied. Now, they were temporarily denied, and they did the work with a psychologist, and they got through their period of grief, and then they came back to the table and had a calmer conversation and a more rational decision-making basis for moving forward with their surgery. And so that's people get a little freaked out about the psychological evaluation, but it's not about judgment or gatekeeping. That part is very important. It's meant to ensure that you understand the performance of the procedure. You understand the permanence of what is about to happen to you, because with some of those gastric surgeries, like a Roux-en-Y, they can be reversed. You still have all the mechanism there available in your body cavities to be able to put things back the way they were. However, with a gastric sleeve, it's a one and done. They throw your stomach in the trash can. You can't go retrieve it and put it back. And so this psychological evaluation is very, very important for that, because you are about to make life-altering decisions. And in some of those cases, it's irreversible. For instance, I have the surgery that's irreversible. My stomach was actually cut out of me, and it'll never grow back. It'll never come back the same way again. And so the psychological evaluations are really meant to ensure that you grasp that concept really well, and that you have realistic expectations for what's going to happen at the other end of that. Because along with weight loss, there are other things that go along with that. And you've heard it said many times that it's just a tool. The surgery doesn't fix you. The surgery doesn't just overnight make everything better. You still have to do the internal work. You still have to do the work of the mind. You still have to break those associations between your own psychology and what's in the refrigerator. And also you want to make sure that you have emotional and social support in place. I think that might be another reason why psychologists might consider either delaying a procedure or just not recommending it at all, is if people are not in a good, healthy space and have support. And also this surgery changes your anatomy. Whether you have the one that's reversible or not, it changes your anatomy, and it doesn't automatically resolve those coping patterns that you've found yourself in over the years. The surgery itself doesn't reset your emotional regulation, and it doesn't shift your identity overnight. And I can tell you from personal experience that the body dysmorphia never goes away. It never goes away. I've lost weight in the past and had it off for years, and this time I've had it off for years, and I can tell you that unless I'm physically standing in front of a mirror staring at myself, I still view my existence in a 315-pound body unless I'm physically seeing evidence otherwise in the mirror. So when I look away from the mirror, in my mind, I am still in that 315-pound body. And I don't know that maybe over time that will go away, but it's definitely still there. And we're talking 3 years out from my original bariatric surgery, not from plastic surgery, but from the gastric sleeve itself and the beginning of weight loss. So, you have to understand that all of that anatomy is going to change, and your body isn't necessarily going to snap back to whatever it was before. I mean, that's all going to depend on age and, the wear and tear of the collagen in your skin tissue, and it also, the surgery also doesn't just automatically resolve your identity and thinking, as a fat person. 'Cause let me tell you, it's different. It's a different world out there when you're not overweight, and it's hard to remove yourself from that mentality. Um, you know, so I think the psychological aspect of it is very necessary. I think a lot of people give themselves worry over it without really knowing what it's for. And I think it definitely has its place. I don't think it's ever going to go anywhere as far as, the prerequisites for the bariatric surgeries. I think it's important to know where somebody is mentally, emotionally before they move forward. So then we got to surgery day, and everything was completely smooth. Honestly, there were no complications in the operating room. Everything went according to plan. I did ask my surgeon to take a picture of my stomach laying on the tray. And he did forget, so thanks for that. I was curious, I'm a nurse, I'm morbid, and I just wanted to see it. And so my brother actually, when he had his surgery just the other day, his surgeon took a before and after picture of his stomach. He had a gastric sleeve as well, so the stomach was cut out and removed. And basically what they do is you have your esophagus, and it comes down like this, and then you've got your pouch belly right here, right? And then the stomach part continues on into the sphincters, moving into the small intestines and the large intestines. But that pouch right here, the stomach pouch, is just sliced off to where it's just the tube, the esophagus tube basically continues on one long line at that point, and you're basically left with a little pouch that can be filled up far less than the original stomach pouch. So that's the anatomy change that you're looking at. But anyways, there was no complications with the procedure itself, and my pain was very well controlled. I experienced zero nausea while I was in the hospital. The same day as the surgery, because I believe my surgery started at 8:30 in the morning. And by that afternoon, I was already up and walking, taking small sips of water, using the bathroom independently. I was already, doing all that stuff. Of course, I'm, very familiar with the cords and the IV poles and all of that stuff. So it was easy for me to navigate around. I would advise anyone that's not familiar with navigating with those IV poles, please ask your nurse for help. Don't get up and scoot around by yourself like I did. And so I was using the bathroom by myself. I was moving around without issues. They had me walking up and down the hall, and this was all just hours after the surgery. Everything was fantastic. I wasn't hungry, and it was interesting because I couldn't recall a time when I wasn't hungry. So, and now that seems to be the my new current state, is that I don't feel hunger anymore. Eating now is really kind of a social event and kind of a life sustaining event. And I do still very much enjoy flavors, but I can only get a couple of bites in before it becomes uncomfortable. So I make sure that every bite counts. I was actually talking to my husband about that just the other day, that, with limited bites, I just make sure that everything is as packed full of flavor that I like and nutrients, since I can only get so many in a day. And so what's the point in having something that you don't like when you're limited on how many bites you can have? So, the pain was very controlled, nausea very controlled, and because there were no issues, I was discharged the following morning. Now, here's something really important that I want to pause on. When doctors say a surgery was uneventful, that it doesn't necessarily mean that recovery will be effortless. It just means that, medically uneventful simply means that there were no surgical complications. There were no, bleeding issues. There was no unexpected anatomical changes or challenges that they came across, and no emergency intervention was needed. It does not predict how the body will respond afterwards, and that distinction matters. It definitely mattered in my case. So just beware, you're not in the clear just because you had a good time at the hospital. My hospital roommate, by contrast, she was a lot younger and had far less weight to lose than I did. She was probably one of those people who had like a secondary issue like diabetes, and you don't have to hit as high of a BMI if you have secondary medical issues that can be resolved with this surgery. So sometimes people go and have this surgery even when they're just a little bit overweight. But regardless of that, she struggled significantly more than I did with pain and nausea. And while I was getting discharged, she was being told that she had to stay another night. And we had our surgery at the same time. So I say that just to let you know that, recovery isn't predictable, and it isn't tied to age or size or willpower. So you really want to set yourself up for success, because so many little things can go wrong. You want to make sure that you have dotted every I and crossed every T before surgery. So, across my own family, experiences really kind of varied as well in this situation. My husband and my brother-in-law and I all had surgeries, and surgeons who expected us to stay at the hospital at least one overnight stay to monitor, early recovery and catch any issues. Meanwhile, my brother just recently had, and we all had different surgeons as well, I might add, but my brother was in a completely different health system, And he also had the gastric sleeve and was discharged home the same day out of his medical system. And there are so many variables that influence recovery: nervous system sensitivity, inflammation levels prior to surgery, stress. Just the stress of having a surgery is stressful. What was your sleep quality like the last couple of weeks? Do you have support at home? And none of them are moral failures, but they're definitely things that you have to consider before you have surgery. So after surgery, I was sent home the next day, and the first few days, they they came with sensations that were completely normal post-op, but rarely discussed. And so, just so there's no surprises for you, gas pain is the big one. Now, when they go in to do a gastric surgery, they're going in with scopes. And so that what that means is there's just little punctures. They're not cutting you open and they have like the whole field to play with. What they're doing is they're puncturing scopes into your skin. So you'll have a handful of these tiny little puncture wounds that usually have skin glue on them. And they go inside, and one of these scopes actually blows the belly up with air, with oxygen, so that they can see what they're doing. It gives them space to work without injuring other tissue or the abdominal wall. And so that air doesn't all come out at the end of surgery, and it stays trapped inside of you. Well, your body's going to want to get rid of that some way, somehow. It doesn't belong in there. And so what usually happens is gravity helps those bubbles kind of roll up, and you're either going to burp them out or fart them out later. But you can feel this huge sense of pressure with gas pain that happens right up in your chest, and it especially like in your upper shoulders, your upper chest, and it can be rather painful. The pain is caused by the gas, and it's not going to hurt you, but it's there, and sometimes it just has to be worked out. And many people experience a sense of like tightness or pressure rather than really sharp pain, but it's enough to really ruin your day. It can stick around for a couple of days, but it'll typically resolve itself, and you don't have to do a whole lot. Now, getting up and walking around, that's going to help move it. So if you're uncomfortable in the moment, try to spin a circle around somewhere and do a little bit of ambulation, and that'll help that gas to move and get rolling out. Right after surgery, of course, fatigue can feel very disproportionate to activity. But you also have to remember, you're not having any calories usually for a couple of weeks. And if you are, it's like small bits from like protein shakes and stuff. So, your body's going into starvation mode, and it's going to attempt to save as much energy as it can. Also, your temperature regulation can feel off. And let me tell you, that does not get better with ongoing weight loss, because the kind of weight you're losing rapidly is brown fat. And that's your insulation, man. So I have been absolutely freezing. This morning, it was like, I don't know, 55 degrees. And I had 3 layers of jackets and a scarf and gloves and a beanie, and a hood. And so, yeah, I'm cold. All right. I don't know what happened just then, but I'm back, and I was talking about being cold from a few days after surgery. So, that's initially after surgery. That is you being just processing the anesthesia out of your body. But then you're going to continue to lose weight, and you're going to be cold. And my temperature regulation is still out of whack, but I do feel it getting easier now 3 years after the surgery. So I would say it took a good year once I got to a solid body weight to get back to where I could tolerate cold in some fashion. I'm still very intolerant of the cold, but I'm better now. So my immediate post-op week was honestly very uneventful. But, I had no nausea, I had no significant pain. I felt stable enough even to go back to work a little bit earlier than expected, although they pushed back and told me that I had to take my days off. They were like, no, do not come back. And this is where I want to be very honest, because this is where a lot of people get blindsided. Week one can feel deceptively calm. And it can feel like it's, that the calm is not going to be interrupted, because you feel like you're getting better every day, and every day you're able to take in a few more calories. And so it starts to seem like you're going to pass through this without any issue. But weeks 2 through 4 post-op is really where many common post-op issues start to surface. So, make sure that you've got your you've got your antenna up looking for issues 2 to 4 weeks after surgery. Just because you have an easy first week post-op does not mean that something could not possibly go wrong later. So you definitely want to be on guard, not because something is going to go wrong, but because the body is still adjusting faster than the mind can keep up. And so you really want to be aware of what's happening with your body. Dehydration can actually surface a lot faster than expected, and I still battle dehydration on a daily. Your taste and your smell can change abruptly, and where things that you used to love you may all of a sudden hate, and you can actually develop some food aversions this way. It's really interesting how your taste changes after this surgery. I actually, I've heard of people who end up developing an aversion to protein shakes, which I think is very unfortunate, because, how else are you going to get your protein early on after surgery? So I think with those people, they just kind of have to get over it and stomach that stuff no matter what. And because you can't, there's not like a tablet you can take, you got to chug those shakes. For me, personally, the aversion happened with water. Just the taste of water. Could not handle the taste of water. So I had to start putting flavor packets in my water just to get it down. So yeah, food aversions can definitely happen. If you have a favorite food prior to surgery, you may not like it after surgery. So just brace yourself for that. And, hang on, I've got to let somebody out. Okay, where was I? Oh, so what else happens to weeks 2 to 4? So your hormones can actually shift really rapidly. Your metabolism changes almost overnight. There's actually some areas of the stomach that they cut out that change the hormones immediately. And emotionally, this is often the window where doubt creeps in. This is where people start experiencing buyer's remorse. This is definitely where I started having buyer's remorse as Hell Week was approaching. So in post-op week 2, that's where my story personally shifted. And I experienced my very first ever episode of cyclic vomiting. And it came suddenly, and it lasted about a week and a half. We lovingly refer to that as Hell Week. even though it was a week and a half. But during that time, I experienced some very real buyer's remorse. I was uncomfortable. I was disoriented. It was quite emotionally taxing. Um, I want to name that clearly, not to scare anyone, but to normalize it. I don't want to normalize cyclic vomiting, but I just want everyone to know that, experiencing post-op issues does not mean that you failed. It doesn't mean that something went wrong. It doesn't mean that you weren't strong enough. It means that you're human and your surgeons are human. And, shit's gonna go wrong sometimes. And you just have to prepare yourself, brace yourself with knowledge, make sure that you are as educated on your procedure as you possibly can be. Do I recommend watching YouTube videos of the surgery itself prior to going to surgery? Absolutely not. I do not recommend that you ever look at a surgeon. Now, am I going to do that? For sure. I want to know every step all along the way, but not everyone can stomach that. So please only look up, people telling you about their experience or surgeons talking about experience. Don't watch a video of the surgery itself. You're honestly going to have nightmares. It's not pretty. So, so my first week out of surgery was great, and then the cyclic vomiting started. Um, it was terrible. It was absolutely awful. It was the first time that I had ever asked for an ambulance. Of course, I was already weak and I was already, malnourished from my first week of post-op recovery, where, I was lucky if I could get a bottle of protein drink or protein shake in a day. And, so incrementally climbing for more and more calories. And then the prospect of moving to like some fine soft foods, the week later. But to already be malnourished and dehydrated and then start cyclic vomiting, I had some vasovagal episodes, and had one about 2 o'clock in the morning, where I got up, I went, and mind you, I'm still throwing up every 15 to 20 minutes through this, and this is about a week in, and we had already been to the emergency room several times, and about 2 o'clock in the morning, I went to the bathroom, just to pee, and when I got up, everything went black, and I went face down on the, I did one step into the hallway and fell face first into the ground. And so, at that time, I'm 315 pounds. I'm a week out from surgery, and I have no energy whatsoever. And so, Mr. Moon wasn't able to pick me up off the ground. And I wasn't able to get up. So I said, I'm going to need you to call an ambulance. And there I am, in my birthday suit, because that's how I sleep, face down in the hallway, and here comes 15 firefighters, police officers, ambulance, whatever. And poor Mr. Moon is just beside himself, and doesn't know what to do or how to help. And, he's trying to get me some clothes on, and everybody's running around, and they're trying to figure out we have a narrow entryway, so they were trying to figure out how to get the gurney in through that direction, and it was a mess. It was a mess. I have since had ambulances come to my home on 5 or 6 additional occasions, 3 of which were this last round of cyclic vomiting that was triggered from the head injury. So, yay. We're still waiting on the bills for those. But I digress. So surgery changes your anatomy. It does not instantly resolve coping mechanisms, nervous system patterns, or the ways that we've learned to manage stress. We didn't get to 315 pounds for no reason at all. There's definitely some psychological damage there. And so then it's up to you after surgery to do that heavy lifting. You've mechanically made it impossible to overeat, but you still have to do the mind work. You still have to do the internal shadow work. You've got to figure out what was causing you to need comfort to such a level that you got up to 315 pounds. So surgery is just the mechanical band-aid on top of that. You are the one that has to learn that you can't just eat to fix your feelings anymore. And when those familiar soothing strategies are removed or disruptive, the body sometimes speaks louder before it learns the new language. So you're not gonna enjoy that sitting with your emotions and not being able to throw a cheesecake on top of it. It's hard work, but it has to be done, or over time, given time and enough food, you could find yourself back where you were. Absolutely. This is not a permanent fix. This restricts you for a limited amount of time. And if you're not good to it, then it will go back to what it was. And so you've got to keep that in mind as well. And that will be part of your, initial pre-surgery psych evaluation. That'll be part of that. And that doesn't mean that surgery, was a mistake. Like you don't want to sit there with your emotions and go, oh my God, now I can't feed my emotions a cheesecake. That doesn't mean that your surgery was a mistake, because it's not going to feel super great for a while. You have to learn how to process the thoughts and emotions that you have. They call it, what do the kids call it nowadays? Raw dogging it. Yeah, you've got to raw dog it without the cheesecake. You got to feel those feelings without the cheesecake. It means the body is asking to be listened to in a different way. And you have to keep your ears open to that. Recovery, the physical recovery, it's not linear. And, I hope for you that you don't have the same experience that I had with the cyclic vomiting. I do believe that's under control now, but that's a personal journey, and that is not to say that people who have gastric sleeve are at risk of becoming someone who suffers from cyclic vomiting. That was completely unrelated. But, two people can have the same surgery, and I'm experiencing this with, myself and Mr. Moon and my brother and my brother's husband, that we all had different surgeries, different walk away experiences, different surgeons, different requests prior to surgery, different recovery plans. Two people can have the same surgery on the same day and walk away with entirely different experiences. And that's what I'm trying to relay to you, is that, you're never going to find a channel that can tell you exactly what's going to happen, because everybody's journey is different. You come from a different starting place. You come with different baggage. You feed cheesecake to your feelings for a different reason than I fed cheesecake to my feelings. So there's no one right way to do this, and there's no one right way to recover. And that context matters, because comparison is one of the fastest ways to turn healing into shame. Comparison is the killer of joy. And the same goes for when you're comparing things as serious as a surgery recovery. So I don't want anyone to look at people's experience on YouTube and go, oh, well, my mind didn't go that way. I must be doing something wrong. That's absolutely not the case. It's like fingerprints. Everybody's got a different experience. And that, Hell Week, Hell Week, which was actually more of like Hell 2 weeks, that experience taught me something really essential about listening earlier to myself, before discomfort escalates into alarm. Like a lot of us, especially people who are having this surgery, they don't tend to be really in tune with their body. I mean, you got to a certain weight, by not paying attention. And so I feel like that experience alone, where I had this false sense of security that I was through the woods and that I was going to make it fine on the other side, that this was a piece of cake, and then Hell Week started. And so you've got to pay attention to the little things. You've got to pay attention to the very small signs, especially that close out of surgery. Because you want to identify things and you want to address them before they turn into, DEFCON 1. And that's where this metamorphosis truly began. My metamorphosis. It was right after Hell Week. That's where I got to really start digging in and figuring myself out, learning my new self, not with perfection or control, but learning how to stay present in a body that keeps changing. And we'll dive much deeper into cyclic vomiting, nervous system regulation, and what that all taught me next week. But for now, I want to leave you with this truth. Difficulty does not negate intention, and struggle does not erase wisdom. Sometimes it's simply part of the learning curve of becoming. So I'm so happy you joined me today. If any part of this resonated with you, please know this, that I'm here, and you can reach out and ask me anything about my experience. But I do want to stress that it's like fingerprints. Everybody who goes through this is coming at it from a different perspective, from a different walk of life, from a different path that they've taken, and they've got their own work to do. And I can certainly tell you how I did mine, but again, it's such an individualized experience, that I want you to keep that in mind. So thanks for being here with me, Moonlit Circle. Keep dreaming, keep wandering, and keep glowing. Gwendie out. By the light of